So my project is on post-stroke depression, and the article I researched was, is post-stroke depression the same as major depression? So I got this article from the Journal of Psychiatry and Neuroscience. Its impact factor is 5.861. The author of this paper was Paul R. Albert, and it was the publication date is March of 2016 or 2018. So what causes post-stroke depression? It's typically triggered by an ischemic event, which is the lack of blood flow within the veins and arteries within the brain. It's white matter lesions in the left frontal cortex or the left basal ganglia or brainstem. It can be any of the above, and those typically result in affective and apathetic symptoms of depression. So they're very much related with post-stress depression or post-stroke depression has a lot to do with regular depression, and as you can see from the statistics, 30% of these patients have comorbid major depression along with their post-stroke depression, and 80% have milder forms. So how strokes trigger depression overall is still unclear. There's still research being done. But it's potentially due to the loss of personal independence and sudden handicap that these patients are, they're realizing, and it's influencing their lives. So there were rodent models within this study. So what they did was they found rodents and gave them middle cerebral artery occultation lesions, and these developed sensory motor impairments within the rodents. So they found within these sensory motor impairments, if they were combined with chronic stress, they could result in depression phenotype behavior. So it was decided that these lesions could potentially be the reason that these post-stroke depression patients are experiencing the depression that they're experiencing. So there are some similarities and differences between post-stroke depression and major depression disorder. Post-stroke depression is a form of vascular depression, so it's pretty much where the blood in the brain is being constricted, and there's lesions, and it's an under like it's a type of the depression. It's not necessarily the major depression disorder. And it's in the neuroinflammatory phenotype of depression. So that's how it presents itself, due to neuroinflammation. So a lot of what the research was done was over covert and silent strokes, which apparently are hard to detect, and they don't normally get scanned for, or they're not normally seen before the patient has another issue that requires imaging. That's usually when these covert or silent strokes are seen, and those have a much higher rate of occurrence rather than full strokes, and ones that are more easily seen through testing that is not imaging, through sensory motor issues and things of that sort. But covert and silent strokes don't necessarily have those symptoms. They're smaller lesions, so they're not necessarily spotted until there's other imaging done. So the incident rate of covert strokes in depressed patients is 46%, which pretty much means that these depressed patients, when they go in and have these scans done, they discover that these covert strokes had occurred. So does post-stroke disorder, or does post-stroke depression slash vascular depression, because they're interchangeable, I guess, responds to antidepressant treatment? So as I was saying earlier, the covert strokes are often only found after another event requires the imaging. Um, so they're often seen through these repetitive transcranial magnetic stimulations, and this is one of the treatments for major depression disorder, and they're using it as another kind of treatment for post-stroke depression. Post-stroke depression is often treated with antidepressants like selective serotonin reuptake inhibitors. Um, and chronic use of these may actually result in higher levels of neuroplasticity. So it could actually assist in the rebuilding of brain structures after this cell decay and neural decay. So the etiology of post-stroke depression and depression, the inflammation link. So as I said earlier, it's the neuroinflammatory phenotype of depression, and this can be a subsection of clinical depression, because this is, like, with clinical depression, we don't normally do brain scans. It's normally a visit with your therapist or with a psychiatrist, and then going from there. However, when it comes to these post-stroke depression patients, they're often getting imaging, and these images are showing the neuroinflammation. So it's a potential link between the inflammation of the brain and depression overall. So a lot of these traits for clinical depression versus post-stroke depression are still up for debate. There's no definitive answer that's been given on the exact reason for post-stroke depression. It's still being debated upon, and um, within the remission rates, selective serotonin reuptake inhibitors are about 50% active, or 50% of the patients who take them are affected by them, and it helps with their cognitive abilities and helps get them back to the state where they were prior to their stroke. Whereas within clinical depression, the rates are a little bit different. And for post-stroke depression, the remission rates for the SSRIs are about 30%. So it's a little bit lower than the rate, which actually helps the patients. So this neuroinflammation is continued to being studied. It is one of the most notable aspects of the post-stroke depression, and one of the aspects that are being researched the most, and it may influence further clinical depression studies by implementing more brain scans and looking for this neuroinflammation and what within this neuroinflammation may cause these depression-esque symptoms and the depression phenotypes and all of these behaviors that are abnormal for people without depression. So it's a really important study to be done, and it's influential to how we are going to study depression in the future. So how are these two really different from one another? Well, one is neuroinflammatory, and one you can see on a brain scan, and you can treat it the exact same way, but they're different names for these for these impacts on people. So the clinical depression is not treated the same as post-stroke depression. It's not treated as a neurological disorder necessarily, because we're not doing the scans and everything that's necessary to be able to correlate between the two. So I hope you enjoyed my presentation. I learned a lot doing this, and I hope you have a great rest of the semester.